Denzil and excuse me, and Anuradha will be joined by two great panelists, and we'll have a pretty robust conversation. So our first panelist joining the conversation is José Ramón Fernández-Peña. He's joining us from Evanston, Illinois, where he is Director of Health Professions Advising at Northwestern University. And he's the immediate past president of the American Public Health Association. Dr. Fernández-Peña has served as a public health expert at the national and the international levels. And in 2011, the White House recognized him as a champion of change for his work on immigrant integration and public health. Welcome, and thank you so much for joining us today, Dr. Fernández-Peña. And then joining us from Sacramento, California is Beatriz Hernandez. She's an organizing fellow at the California Immigrant Policy Center. Beatriz, with a background in community organizing surrounding issues of immigrant rights and integration, sustainable food security, she fosters partnerships among organizations and coalitions and organizations and coalitions in the Central Valley and Sacramento area to enhance representation, access, and equity of immigrants. So welcome, Beatriz. How are you?
Hi, everyone. I'm doing well. Really happy to be here.
Cool. Thank you. All right. Kind of twiddling my fiddling my Zoom screen. Let's start here with Anuradha. So you had mentioned kind of the limitations of interviewing people via Zoom. Now, acknowledging that we have a limitation of doing a panel conversation via Zoom. But I was wondering if you can kind of give a little bit more context of how those conversations went. What was the sense that you got from people? What was their emotional health like? Because it's just been an incredibly stressful 2 years, and you were asking some pretty probing questions.
Yeah, I think, as I said, a big part of the approach in this study itself was that a lot of immigrant essential workers are invisible laborers, and as such, they don't necessarily, unless they work as a home health aide or another really, when they're in an intimate situation with the person they work with, they are pretty isolated from the people for whom they provide services. I think gaining trust was definitely challenging. I asked questions that could be perceived as, exploitative. And I did my best to build a sense of conversation, and made sure to tell people that they would be anonymized, and, we were using this to hopefully recommend positive policy changes. And as you said, mental health was certainly poor. And that's, something I spoke about with basically everyone that I interviewed.
Yeah. Was there something in those conversations that, as you think back to them, that surprised you?
No, I think it was more about wanting to balance a picture of, kind of not telling just a story of victimhood or a story of resilience, but kind of showing how people perceive themselves as active agents in building better community involved, but at the same time are not being given the tools to assist in their own well-being.
Beatriz, I'm going to get a little fanboy here because I am a huge fan of the Immigrant Policy Center in California. Just for years, everybody there has just done such incredible work. And so I just wanted to start with that. And just, that way, I can explain my blushing. But one of the things that took place over the course of the Trump administration was their consistent and very aggressive efforts to, in essence, change the public charge definition and really do everything that they could to eliminate any sort of eligibility that even folks who are here legally have for benefits and services. So as that was taking place, all that took place even before the pandemic. And then the pandemic hits, and there's just this double, triple, quadruple chilling effect of pandemic policy changes, misinformation, politicians weaponizing all of the above. So what did you see on the ground in California, and how did you see all of these kind of factors affecting families, over the course of the last few years?
Yeah, I want to start off by saying that I'm also a really huge fan of CIBC, hence why I'm here. Thank you for inviting me. For me, I mean, first of all, I would like to say that the work that I do or whatever I'm going to share is from what I do as an organizer, but also coming from a family who's undocumented, and I'm undocumented myself. So it is things that I see directly when I go home and visit my family and my siblings. I guess like during the pandemic, what I saw is a lot of mixed emotions from community members, right? First, having to deal with the fact that they were getting laid off from work, and then not having the resources available to them to like really thrive and be healthy through the pandemic. And then on top of that, having to deal with like having to get the vaccine, and some of them not being really trusted of like elected officials and like the hospitals, etc. So we really had to like grab all of that around and like really try to find like the ways to really message and like find that trust with them, to make sure that first, that they're getting vaccinated and that they know that this is something that we all need to do to keep us safe. And second, making sure that they have the resources to thrive during these difficult times. And third, that we're there, for one another as community members first. I mean, not just workers, right? But really being there as neighbors. But yeah, I think it depends on who you talk to, right? I know that when I would go into like the fields, when I used to be in another organization, I would go into the fields and, talk about the vaccine, the census, and there was a lot of folks who were open to getting that vaccine, right? But then there was some who were like very hesitant. So I think it took different kind of messaging, of course, and who came to them with that messaging. Like, for example, with my family, I think it's really interesting because I'm having to play this role to go out there and talk to community members about the vaccine, right? But I'm also having to go back home and do the same kind of messaging with my parents, because to be quite honest, both of my parents were very hesitant to get the vaccine. So even for me as an organizer, it was really hard to like come to the like grapple with those feelings of like, okay, I have to do both things with my families, and like, how do I do this? But I think like them hearing it from me as their daughter and me being in this work, I think that opened it up for them to be more trusting of getting the vaccine and getting vaccinated.
Mm-hmm. I mean, some of the work, that I've read about and talked to folks, and just in terms of vaccination of the farm worker community has really been quite tremendous. And, you mentioned kind of who people will trust. In your work, how did you kind of discern, okay, this is the person that we need to work with that can be trusted?
Yeah. Oh, well, here at the California Immigrant Policy Center, we have this project called the Regional Capacity Building Project, which is made of different organizations throughout California. And we're really here to build our capacity, but also we really listen to them when we're pushing for policy at the state level. And whenever we want to get information out there, or we need to know what's happening on the ground, we really rely on them and their expertise and the relationship that they have with community members. So I would say whenever when we're thinking about who do we go to that we know that our community members trust, it definitely has to be those community-based organizations that are on the ground and always having that connection with their neighbors and putting those resources out there for them. And also on top of that, I would definitely say faith-based organizations, because for instance, for my personal experience and being Catholic myself and being in those spaces, I know that a lot of folks in the Hispanic community really trust their faith-based leaders when it comes to getting information. So that is another partner that I try to also partner with.
It's fantastic. So Jose Ramon, you are a past chair of the American Public Health Association. You probably don't know this, but I'm a past member of the American Public Health Association. That's all I got for you. I'm just trying to draw a connection.
I'll take that.
No.
I'll take that.
No, but I when I was in Boston, I worked for two health centers in the Dorchester neighborhood, and really came to appreciate the contributions of the foreign-born healthcare workforce. And I think that's been brought into stark relief, not just through the report, obviously, but then I think more broadly across the country. So I was wondering if you could speak to your experience of integrating, excuse me, immigrants into the American healthcare system, and just how valuable you see from your national perspective the foreign-born talent in the U.S., particularly with the healthcare workforce.
Yeah, I think it's a very important question, and a lot of the conversation that has just happened, I think, is a reflection of how a health workforce that does not reflect the population it serves is a contributor to this misinformation, and more especially the disinformation that intentionally has occurred. We have been working with international foreign-trained health professionals for the past 21 years almost across the country, and we have been able to integrate thousands of them to a workforce that A, is not enough in most places, and B, does not reflect that cultural and linguistic diversity of the population. I want to make a point about the previous conversation on mental health. The mental health workforce is smaller than the population that needs it. There's not a proportional number of mental health workers, especially in rural areas. In addition, when you talk about diversity of the mental health workforce in terms of language and culture, there's practically zero. And the circumstances of the pandemic, where multi-generational households were living under one roof, holding essential jobs, not having the ability to protect themselves or their loved ones, we saw an increased incidence of cases of domestic violence and issues of substance use. Neither one of those could be properly addressed in the absence of a cadre of mental health professionals that could work with this population and protect and provide those services. And that's an ongoing problem. It was a problem before COVID, and it continues to be a problem after COVID. I think to the point that Beatriz was making a minute ago, who is the trusted speaker for the community? Who is the trusted entity? Is it the priest? Is it the bishop? Is it the butcher? Is it the la portera del edificio, the door person at the place you live? Is it the teacher? Who is that person? We failed, I think, in identifying those individuals early on. I think that what we also saw was what often happens. It happened with HIV, and it's happening again now. We saw the medicalization of a public health problem, and we went immediately for investments in vaccines, which is fabulous and wonderful. I'm grateful for those, but we forgot the prevention aspect of the work. We did not invest enough resources in educating the population and providing answers to all the legitimate questions that were being asked. So I saw that somebody said, how do we convince people? I don't think we convince people. I think we work with people to answer their questions. We work with people to understand their concerns and provide accurate answers. And we explain why Uña de Gato is not going to do this. We explain why it's important to do X, Y, or Z things that actually are science-based and evidence-based interventions that can protect us from the spread of the disease. So having, back to your original question, Ali, the more diverse your health workforce is, the better understanding of these issues we will have, and the more effective implementations and program developments will be that are tailored to specific communities. So I'm always kind of, upset is a word, when I see that we develop this great flyer or this great thing, and then we hire somebody God bless you, to translate the thing, and we end up with a product that doesn't make any sense, but the community that is supposed to benefit from that information doesn't get it. It's a register of the language, it's the imagery that is used. It's all these things that are not rooted in what the community needs. And that's an essential public health aspect of the work that we need to do.
And Let me come back. Let me come back to the misinformation, disinformation question in a second. But I wanted to pull on a question that came in the chat for Anuradha. And the question asks, did you see any difference between immigrants who might have had higher education training from abroad versus those who picked up their essential work and training in the US? Were the foreign trained individuals able to use their skills in essential jobs, or were they underemployed?
I think it really varied. There's a lot of studies that show that a lack of easy licensing makes it really hard, especially for healthcare workers, to transition. So I spoke to someone who works at the Mayo Clinic as a nurse, and she said that she moved here and had to do all of her degrees from the start all over again. And on top of that, get enough education and more degrees and certificates and proving that she knew how to speak English. So there's just a lot of requirement, even of people who might immigrate to the country with higher degrees and perhaps a more specialized skill set. And I think the licensing issue plays a big role in that.
Yeah, I think Denzil had mentioned this in the initial presentation, just the importance of the changing of licensing. And I know CIPC has worked on this quite a bit in California. Am I right, Beatriz?
Oh, what again? Excuse me?
On the licensing issues.
Licensing issues?
In essence, allowing. So as we went through the pandemic and continue to go through it, how did the advocacy take place in California? I mean, there's a massive number of bills passed, and from my reading, a number of them treated the immigrant community quite constructively. So what were some of the advocacy strategies that you all found so successful?
Yeah, I think first we really had to, highlight the fact that undocumented immigrants were excluded a lot from a lot of COVID-19 reliefs. First of all, federally, right? We were excluded from all of that. We had a Golden State stimulus, which was also a one-time payment to some families, but not everybody benefited from that as well. Some undocumented workers did, but they had to have an IT number. So those who didn't have any were excluded. So basically all that to say that there was not a lot of safety nets for us out there to keep undocumented workers thriving. So what we did, or what we're continuing to do, first of all, is making sure that they have access to health insurance, right? So we pushed a lot for Health for All, which is one of the campaigns that has been going on for a couple of years. And thankfully, we were able to win a big win when it came to Health for All. We removed exclusions to health insurance for elders 50 plus. So that was a huge win. We know that, you can get the COVID vaccine whether you have insurance or not, right? But we need to make sure that people are healthy, even past, before or after the pandemic, right? So that was a huge win, and we're continuing to move that forward to remove the exclusions for the remaining group, which is 26 to 49. Right now we're working with this campaign coming up called Safety Net for All, which is trying to come up with a wage replacement program for undocumented workers, given that we're excluded from unemployment insurance. And we know that through research, we've seen that what's actually getting people through the pandemic is unemployment insurance and not so much stimulus checks, right? So knowing that, we know that undocumented workers don't have access to that. So, that is something that we're working through, getting some type of wage replacement program for undocumented workers, which is going to be one of our huge campaigns for next year. And we're hoping to get something through the legislature. We're also working on a campaign called Food for All, making sure that people have access to foods. Given the fact that through the pandemic, we also noticed here in the Central Valley and California, it just heightened the accessibility to food. A lot of people here in the Central Valley don't have our food insecure, which is really crazy to think, because the Central Valley produces a lot of the food for not just in California, but for the rest of the nation, right? Which is just observed. So we're really trying to figure out how do we have all of this, create an infrastructure where, you know, an infrastructure that has all of these resources for people to really make sure that they're safe and healthy during the pandemic, but also after the pandemic. So in case we were able to, again, come out with a health crisis, we know we have a system in place to make sure that people are not left out and excluded and, you know, go through 2 years of people getting left out of work, not having enough money to pay for the rent, et cetera.
Makes a lot of sense. So Nathan had a question in the chat that I think is a good question for all of us. It's something that I often think about and grapple with. And the question is, with all this talk about, quote, essential work, do you see that the work or this message is actually feeding to the ideas of work and the immigrants' worth as being defined by their contribution, which then has the potential to lead into kind of the deserving versus undeserving tropes? I would agree with Nathan that this is a challenge when we try to humanize the narrative. So would love everybody's perspective on this. And Jose, Ramon, I thought we'd start with you since.
Yeah, I understand the question, and I'm saddened to read it, but I know what you're talking about. I think that we need to be careful with this kind of labels and narratives, because the essential worker, I mean, as defined tightly in the study as those who actually put food on our tables at the end of the day, or take care of our babies, or drive the bus we take to go to work, or teach our kids in grade school. So, but that's not what gets out there. The essential worker may be interpreted by others differently, and that's a dangerous position. I think that the kind of work that many of us have been doing over the years has been on changing the narratives about immigrants and essentially stopping the nonsense that the previous president brought up in regards to who Mexico sends or doesn't send to this country, etc. All those racist and stupid, frankly, comments have gone against the work that many of us have been doing for a very long time. So understanding that not only this country was founded by immigrants, that are the product of the brilliant minds that have come to this country is what made this country great. And that continues to be the contribution that everybody makes in any area and in any field. It's great to have a fabulous neurosurgeon that came in from Guatemala and is now doing this kind of work in Chicago, but it's also great to have somebody that is leading this school. Or I am grateful for the individuals that when I wouldn't leave home because of fear of COVID, I could call Instacart and have somebody come to my door with food. And 99% of those people were immigrants. So the recognition of what immigrants communities bring to this country is one side, but along with I want to get into this thing of the disinformation, this nonsensical, destructive, and arrogant narrative of immigrants being a burden, immigrants being somebody that come here for a handout. I don't see immigrants anywhere in the streets for a handout. I have never seen an immigrant doing that kind of work on the streets. Immigrants come to the United States to work, number one. Number two, immigrants come to the United States to work. They support their families here, and oftentimes they support their homes and families in their home countries. And that needs to be said over and over and over.
Anuradha, what's your take on the deserving versus undeserving trope that we find ourselves in sometimes?
I mean, I think it's something that I think about a lot, and I thought about it a lot when doing this study as well, because it's so easy to fall into that narrative if you're trying to appeal to people who see growing immigration through that narrative. So it's kind of saying that no, people's value is not defined by the work that they do or by the amount of money that they earn. But at the same time, if this is the lens through which you see the world, is this the way that I need to present human beings to you for you to value them? And so as a constant, and I'm speaking more in terms of a knowledge producer and a researcher, I guess, and in terms of doing the work to shift the discourse and the narrative, I think we constantly have to struggle with these different strategies of appealing to people.
Yep. And then Beatriz, what do you think?
Yeah, I mean, personally, me, to be quite honest, I grew up, well, I came from Mexico, but when I came to the US, I feel like I instantly got programmed to think like, you need to work hard. You need to do all of this to be deserving of XYZ, even like in college, like in order to be deserving of a scholarship, you need to work hard to be deserving of it, right? And that sort of mentality like stayed with me even moving forward. But it's been a few years, like recent years, where I've tried to like really detach myself from that mentality, because I really do think that we should move to a place where we're just talk about like, it's not about being deserving or not, but more so of like, me coming from a sociology background, I think of our society of like, how do we make sure that we all are safe and healthy, and how can we keep functioning? Like the only way to make that happen is to keep everyone healthy. So when it comes to policy work, I think policymakers and like legislators and lawmakers, they need to make sure that nobody is excluded, because if somebody is not healthy, like that is just going to have ripple effect, like a domino effect, and affect everyone else, as we have seen with COVID-19, right? So I think the conversation, whenever we're talking about these things, I think it needs to start from like that community. Like in order to be healthy, we all need to be healthy. And that is why all resources need to be distributed in an equitable way, so that everybody is safe and healthy. And that is just how we're going to function. I feel like it just works sort of like a computer, right? Like if there's a virus, it's just not going to work. So you got to make sure everybody's like working right and safe. So that's how I view it. It's like we're an ecosystem, and to thrive together, that's the only way that we're going to make it happen, right? So it's not so much of like, I work this many hours and I think that's why I deserve like this many dollars, right?
Yeah, I mean, I think this is such a, like I said, it's a thorny question, it's a challenge for all of us. I mean, for me, I always try to avoid the language of high skilled versus low skilled. And I feel, and, so much of the policy framework is set up that way. And we'll just try to say over and over again, our economy needs the skilled engineer as much as it needs a skilled farm worker, and just keep hammering that over and over again. But it's a slippery slope. That's very easy to tumble down. So we're coming up on time, a little more than 5 minutes left, and we've got about 140 folks on this webinar, which is, I think, just a sign of how important the research is, but also how important each of your organization's work is. So I wanted to ask you kind of in closing, and you've also realized by now that I've completely left the script of the pre-planned questions. So I should have warned you of that ahead of time. So my closing question for you is, what are the 3 things that you think a viewer of this conversation, a reader of this report, should do to constructively help stand up, support the essential immigrant workforce, whether it's from a policy perspective or a service perspective? So what are the 3 things that people should do? And I will start with, no, I'm going to start with Beatriz.
I was like, no, pass it on to somebody else. I need more time to think. You mentioned what are 3 things people can do from reading this report?
Yep.
Yes. I think, first of all, let's see, definitely take it back to your organizations and like really go through it, because there's a lot of things that you will be surprised about, that I was even surprised to read, right? Like I am from the Central Valley, but I didn't know that. I even wrote it down, that 70% of farm workers are undocumented, and that the Central Valley is responsible for nearly a quarter of the US food supply, which is huge to know, right? And I think that is so important to know whenever you're doing advocacy at the state level with lawmakers, to put those facts in their faces and let them know, like, here's why we need to do this. Also, I think it should encourage people to do a lot of like deep, what is it called? Deep listening, like to their family members, and like taking that information back to them, and like doing more like story sharing, like just trying to get an insight as to why they have these sort of fears or why they feel a certain way. So definitely taking it back to their families and their communities. And third, I would appreciate, or I think doing more of this kind of webinars. I think it's a nice platform to do a lot of listening, but also a lot of learning from one another.
Thank you. Jose Ramon, and then Anuradha, you get the last word. So Jose Ramon, what are the three things?
The three things, I think, read it carefully. Read it carefully. Listen to the community around you. Listen, understand what the questions asked are. We don't jump to answers, understand what the questions are. Find partners in the community to work with. As Beatriz was saying, suddenly you turn your head and there's 6 groups doing parts of this work that you didn't know were around. And thirdly, do something. And I always say, get involved, give time, give money, write a letter to your legislator, write to your council person, go to the demonstration, get involved. Don't be a passive spectator of this thing.
Thank you. And then last word to you, Anuradha.
Yeah, I would say thank you for reading the report. I mean, I think it's hard to think about 3 things because there's just a lot of things that I learned from doing this research. And I think a big part of what kind of advocacy work we do is in humanizing people who have otherwise been not humanized in public discourse. So I think hopefully if we can talk about these things more, we can engage with people more who might not have access to these resources and to this, and who might not really even engage with immigrant essential workers or undocumented workers in their lives. I think it would be really helpful to take this information, have those conversations, and I just second everything that Beatriz and Jose Ramon said.
Well, thank you. And I get choked up too when I talk about asking people to read research. It just always brings tears to my eyes. I really thank our panelists, Jose Ramon, Beatriz, and Anuradha.